fuck is that? How the fuck that is die Jungbams like that? Ah, ne. What the fuck? That's a new champion Zahin. What the fuck is that, dog?
Honestly, the game was kind of miserable when it first came out, and a lot of people, including me, kind of gave up on hope. Recently, Cyberpunk 2077 has been transformed into just something different than what it was. Everything we hated back on release pretty much, a lot of that stuff has been fixed or solved or at least greatly improved. And while there are holdouts, the final patches and Fix 2.0 update really made it something to talk about, especially with that Phantom Liberty DLC dropped in 2023 and instantly made it one of the best open world action atmospheres out there. The action never stops in Night City. There's always a new way to slip in the awesome fighting or a storyline that leads to a big, violent conclusion. There are characters you meet that get caught up and become fun support adventures. Events explode and escalate into overblown, weird situations. It's the kind of freedom only a game like this can provide. It empowers you to go wild, leading to these fun and satisfying battles other games just cannot provide on Cyberpunk's scale. And I can't stress this enough. To me, this is kind of the standard of what a first-person open-world action game can deliver when it's done right. It's a little controversial to say that because of their fraught release experience, but at this point, it is a solid entry, probably the quintessential example of an open-world action game. And it is. And that's what makes it so freaking good. Sure, it doesn't have, let's say, the emotional gravitas of a Naughty Dog game. You don't have the pulling your heartstrings father-daughter story, but it is set in a similar feeling world, and it's a game that has these massive armies of zombies terrorizing an entire state, and you have to untangle the mystery behind the freaker hordes and the creepy
I'm on war with Judy. What the fuck? I have to click on display settings, but whatever. Is WoW mean, man? I don't vocals. I don't think I can use clothesline. Roll like twice. This is a good early game, but it kind of falls off like a fucking cliff later on. Look at Ma here. So much magic resist. What? Whoa, memed man. Oh, they got him at the very, very end. What the fuck? The one fucking person. It's because they fucking lost. What the fuck? Kidding me? It's a whole second less. They have flash, bro. Loki, they have flash. Oh my god, that fucking bomba. 연탄 됐거나. Is it warm-ups? He's such a trap, but it didn't work. Realistically, that only works on my Q. I'm already on the when I press. I'm already on the when I press Q, bro. Unless I miss my ult. Oh! Oh! We're out. I left the fucking thing for him, by the way, but didn't work.
Experiments that led to the end of the world. This game is absurd in the best way possible. Imagine walking into what should be a regular small town, and suddenly you're being hunted by thousands of zombies, each moving as part of this massive, writhing collective with no
Did I just buy
discernible anatomy
Cyberpunk?
or reason. It's truly terrifying, particularly at night, because you can't go very far. Like, the map is huge, but your brain can only stretch so far, handling the horror this game throws at you. It's open world
$90.
zombie goodness cranked up to 11, and it deserves more attention. Those rural Oregon woods are pretty scary at night, and you'll spend most of your time tuning up your bike and just zipping through while following a steadily unraveling gameplay loop of dangerous riding sessions. Look, this game is open world, free roaming, killing fun. You can never go wrong hunting a zombie. And that's actually all the time we have for you. Leave us a comment, let us know what you think. If you like this video, click like. If you're not subscribed, now's a great time to do so. Don't forget to enable notifications, and as always, thanks for watching, and I'll catch you in the next one.
Made it this.
You requested that we watch the airplane episode of House MD, but I couldn't do it alone. Welcome, special guest, Captain Steve. You ready to take this on?
I'm ready.
Let's get started. Pew, whoop.
Antique vintner's cane.
I might see the
$100.
It had a corkscrew in it.
Ah, that would explain the vintner's reference.
It'd be used as a weapon against the pilot.
Oh, it's so interesting. We just had Noah Wiley on the podcast, and he collects unique canes.
How is this a
Just
nominate
like
title? It's called
you ever
mixed.
have a passenger
It
come
literally
on
has
and
mixed. How are you
Well,
nominated?
yeah, I've seen passengers come out with
How are you
canes
nominated?
before.
What the
but now
fuck?
with weapons.
How is this a
No,
nominated
hopefully.
fucking nominee?
TSA should close that. What could go wrong? What could go wrong?
You know how much WHO accreditation means to the hospital?
It may have been short, but it had
Damage from the room service thing was just spiteful.
I was hungry.
$300 for a bottle of wine.
I was thirsty.
$120 on video services.
I was lonely.
Why do they load planes front to back?
So that's because people pay more for the seats in the front. They want to feel special. And it's nothing more than that. It's just a
It
pandering
feels
to
so
that.
wrong. Like
It
you're
does.
creating congestion.
It's absolutely wrong. But you think loading from back to front is faster. It's actually not.
Really?
Because everybody that stops in the aisle puts their stuff away. You have to wait. Then they sit down in the aisle seat first, maybe by chance, and they have to get up when the next person comes in. It's actually from the outside to the inside, from the back to the front.
Ms. Cuddy.
Requiem
you're in the
for a
next cabin to
Dream.
the left, 9C. No, I booked 2 first-class tickets. This must be a mistake.
No mistake. Just arranged for a $500 fare reduction. Expense problem solved.
Did you ever watch the movie Bridesmaids? There's a flight attendant and she calls him Stove, even though his name is Steve.
Whatever you say, stove.
It's Steve.
Airplanes aren't very healthy. You're not moving.
Yes.
That creates stagnation of blood, leading to potential blood clots
Yes.
forming. You're usually consuming salty beverages
Yes.
or salty foods at the
Yes.
very least.
Do you know why the foods are so salty? When you go to altitude, your taste buds are not as responsive.
No
so
way.
they put more salt in it to make the food taste better, like you're down at sea level.
No wonder, like, the fish tastes different.
Yeah, and blood pressure for pilots goes through the roof because you're ingesting more
And there's
sodium than you
radiation
should.
exposure.
Absolutely.
Do they have you do any kind of extra health screening things as
Peggy
a pilot?
16.
Yeah, my aeromedical examiner looks at it. And they do actually kind of track some of that stuff. I don't like to go to the max altitude I can. But every 1,000 foot, you kind of bump up your radiation.
You
risk.
decide which health every time.
Within reason, yeah, I
Oh,
do.
okay. So what altitude you like not going there?
40,000 and above.
You're like, that's enough.
you know what? I like to stay down around 36,
I'm not
37.
Jeff Bezos. I'm not trying to get
Yeah.
into
I know.
the clouds.
Yeah.
Okay.
Sir, are you all right?
He's drunk.
How do you make that diagnosis? He's struggling, clearly.
Is anyone a doctor?
No, I refuse to believe that.
Yes. I'll go get her.
I'll go get it.
Go get it. You know, that's the one thing I didn't think about. What if you're a doctor, you get asked that question, but you had 3 or 4 wines?
Well, you're still a doctor. It depends on who else steps up, and you don't know how many wines they've had. If I'm in the back of the airplane just as a civilian passenger and I've had a couple of drinks, it depends on how dire the situation is.
Fair. If there's a B-NATO?
If there's a big NATO, absolutely.
Yeah.
right?
Well, now you have
You
experience.
can't let the 11-year-old struggle.
Yeah,
You gotta fly the airplane.
Fever, headache, severe abdominal pain, and a rash all over his lower back.
I mean, that's a broad differential. Could be a medication reaction. It could be an infection. You're even
Can I see
worried
some
about
gameplay?
multiple things happening at the same time, impacting both organ systems. The fever definitely tells us there's some kind of infectious component.
It's serious. Maybe contagious.
Wow. We just attended a symposium on pandemics, and you run right into one on the flight home. Talk about a small world.
It's meningococcus. Half the passengers on this plane could get infected and die before we reach New York.
I don't know if that's necessarily true. We have a vaccine for meningitis. It would have to spread really quickly. While it is dangerous, it's not like, oh my God, everyone's dead. There's some techniques that we do on a physical exam that point to meningitis, including doing one of these movements, chin to chest. And if there are signs that there is potentially inflammation in the brain, you will see that person be very uncomfortable.
Is it like neck stiffness,
Yeah,
or is
it's
it?
rigidity and pain upon flexion of the neck.
We have to turn around.
What? Why do we have to?
We don't. Misunderstood. Dr. Cuddy just meant that he might feel less nauseous if he was facing.
This is like a big ass file. Let me just
Panic,
delete
a
it.
plane load of people.
We're about to head over the North Pole. We don't turn back now. The next DR is
Lux.
15 hours away.
Is that true?
No. So to dispatch airplanes like over the Atlantic or over the Pacific or over the polar cap, there's a thing called ETOPS, and it's regulated by how many engines.
We're back at it with another.
Wait, this game's done? What the fuck? This game's done? Holy fuck, setup's gonna be a bitch.
putting them on without understanding how much damage they can cause, not just from a physical standpoint, but also from a mental health standpoint.
Dry heaves are gone, so am I.
I'll check with the doctor.
No. I'm here voluntarily. Just gotta check with me.
I'm sorry. Dr. Nolan left specific instructions.
Is that true that you can voluntarily check in versus court mandated or
Yes.
doctor mandated?
Yes, you can come into the hospital under voluntary conditions where you're saying, I'd like to check myself in. Now, you have to be evaluated to make sure it's appropriate for you to be there. And then there's the ugly side of this, is your insurance going to cover it? At the same time, if someone is a danger to themselves, a danger to other people, or they're so gravely disabled, we say that they can't provide themselves with food, clothing, or shelter, then they can be involuntarily admitted to the hospital. But in the case of someone voluntarily admitting themselves, House is right. He can say, I don't want to be here. That might be against medical advice or AMA, and that's what they're referring to. Let's have the psychiatrist that has admitted you here talk with you about this.
Got it.
I am a lot better. No painkillers, no hallucinations. Leg hurts, but it's manageable. Great job. Gonna miss you. Want to start missing you as soon as possible.
Well, legally, you're free to go whenever you want.
Are patients in the space where they're using pain medications, are they counseled appropriately, you think, in terms of what the risks are of these medications?
I think these days, yes. In the beginning, not so much. That idea of let's double your dose if you're having more pain. There were a lot of things
like we have to get to zero pain.
Yes.
So oftentimes was an unrealistic and perhaps harmful goal.
Yes, and I think medication, I even say this to patients with anxiety, other mental health issues, medication is a part of treatment. It's rarely the only thing. So what else
Did it say high meth?
that helps decrease pain? It's not always pharmaceuticals.
That's always a good flag, because when I ask patients about timing of their pain, some will say, well, I have it more at this time in the morning or at night, or when I'm doing this activity, and that's true, I want that info. But a big part of it is, are you having it on weekends when you're not working? Are you not having it during weekdays when you're working?
Fucking AI, bro, they
and
will.
those kinds of hints will allow me to tailor the questioning in a different way to better understand what's driving the pain. Because if someone has an anatomical injury, it's not going to pick and choose days of the week when it's going to present itself.
Yeah, and then I think you're referring to something I call, and we call somatic symptoms too. A lot of people feel stress and anxiety as pain. It's not me saying your pain is not real. That's how you experience some of these other emotional things as well, and you have a chronic painful issue too. It just happens to get exacerbated when you have maybe some emotional things as well.
But I suggest you stay.
I'll take it under.
Well, this is gold, right?
If you thought the hallucinations were from your Vicodin problem, why didn't you just check yourself into a rehab facility?
I was deluded into thinking
They
I was
buffed this.
crazy.
But you had been abusing Vicodin for years. Never had delusions, never had trouble sleeping, never had any problems other than narcissism and antisocial behavior until 2 colleagues died.
Why do you think he chose to go into a psychiatric hospital versus a rehab facility? And what is it?
My understanding is that at first he checked himself into medical detox, essentially. This psychiatrist is telling him, I think you need to go into a psychiatric inpatient unit at this point to work on your other things.
What is a psych inpatient unit?
So an inpatient unit means
They have
that
nothing.
you're not living outside of the hospital like an outpatient. You're living in the hospital for typically a short amount of time. An inpatient stay is for an acute issue, something that's often, again, a danger to oneself, a danger to other people, or someone is so gravely disabled that they can't provide for themselves. So you have to work with that patient to figure out is inpatient the best, or an intensive outpatient program where you show up in the morning and you leave at the end of the night better. You do figure out what's best for the patient.
You need to be transferred to our long-term ward, started on medication, talk therapy.
Yeah, I get it. Just one thing getting hung up on. I can leave whenever I want. How about I start with that?
You can't go back to practicing medicine. You're going to need my recommendation.
Can that happen?
It can happen that a psychiatrist or another physician can say, I'm not sure that my colleague is fit to treat people. So if the doctor seems way out of it or seems like they're not thinking clearly because of maybe a mental health condition, someone could say, I'm very concerned about this person practicing, and you might need a letter to reinstate them.
Yo, everybody! This is my new roomie in house, y'all. Anything you gotta know.
Is this the line?
Hey, Gabby! Meet my new roommate house. You
I'm gonna instant message. Who's this? A fucking Coral?
Don't worry, she won't call you anything. She hasn't talked in like 10 years or something.
Where is he now?
There are things in mental health called long-term care facilities. It's different than inpatient. In San
Nah,
Francisco,
looking at
for
contact
instance,
now, what the
there's a
fuck?
place called the Behavioral Health Center, where it's a long-term care facility. Here, it's something similar.
You're just gonna
where
knock
people are
CM Mike and
staying
say,
for
"Fuck 'em all."
long-term stays because of ongoing chronic mental health issues.
Now, something I've always wondered, does it become more complicated when they're living in the community full of other individuals that are also struggling with their mental health? Or does that help in some way?
I think I have the belief that connection with other people really helps, and that's a big theme in this episode too. And I do think people can learn from each other and relate to each other. So there are systematic things that happen
Abby's goated.
that show that they can function in communities, because when you leave, you're actually going to be in some kind of community, just a greater community at large. However, there can be times when someone can influence another, and perhaps there's not good things that come from that.
If anything else, it teaches flexibility and adaptation, which you're going to need in the real world, because there are sometimes be mean people, sometimes nice people, and you never know what to expect, and you have to be comfortable in knowing
Exactly.
your response to that state.
Correct. Yeah.
We can't play that, they keep it locked up. I wish we could, but at the same time, you can imagine how annoying that could be. Crazy people playing on it all the time. We'd never get any peace.
They've used the word crazy quite a bit already in this episode. What are your feelings on the word and what they're trying to show here?
I think what they're trying to show here are that patients are aware that's how they're seen. So the word crazy, I don't like to use it. Sometimes I'll use it with patients and saying, I think you probably have this feeling like you're crazy, but using it in that colloquial sense to say, I know how people might refer to you and how you might be feeling.
She's my husband's sister. See her head? Bob's confused. Any reaction I'm getting from her? It's like you're talking.
You're not talking. Her head is bobbing to her pulse.
Are you a new doctor on the ward?
Technically, yes.
What do you think is going on with that, like, catatonic, like, state there?
Catatonia is a state where people sometimes don't move, or you can have different types of catatonia. You can have a waxy flexibility where you can hold someone's arm up and they hold it like that. Sometimes medications can make people catatonic. In this case, I don't think that's what's going on with this patient. Sometimes people have a reaction to severe trauma and become catatonic. There's some kind of trauma, there's something going on in her background, and we don't know what it is.
See how they give you a ping pong table, but no paddles, no net. It's like they're mocking you.
Preach!
Whoever saw a tennis court without a net?
All right, why don't we just go and sit down and discuss it?
No. I want to discuss it right here.
House is right. I think everyone here can handle this.
He's standing up for his colleagues or not, mates, what? I don't know what they are. Co-patients?
Yeah. What I really like about that is when Dr. Nolan comes in, it's like, yeah, I think you can handle this. It's a good point. So he listens, he can see that they want this. And again, that idea of being seen, being understood, that's really what I think is the connection.
I'd like you all to welcome another new addition to our ward.
What the hit?
A Freedom Master. Steve Alkertine's just a cover. It's like Clark Kent or Bruce Wayne or Peter Parker.
Ooh, we get more Jesuses than superheroes.
Well, I try to blend in the outside world, but I figure in here, everybody gets it.
So this is like a group session that they're having? Yeah. And what's supposed to happen in a group session?
I think even on an inpatient unit and in this setting, the idea is this is community. There are other people here. Let's understand how people react to each other. Let's understand how to speak to each other. What's okay, what's not okay. Each person is a different thing.
So it's like a more controlled communal environment.
Way to relate to each other in a communal environment.
How are you feeling today?
Yesterday, not as good as tomorrow.
Oh.
And is that typical of how medications are distributed?
Sometimes people will come up the line, or somebody might bring the medications to the person's door or something like that. It really depends on the staffing and what the policy is. What's interesting here is I don't know why he wouldn't be taking something. What are they giving him that he's not trying to take? Because if he's taking anything for detox still, he'd want to take that.
Yeah.
And he's not behaving in ways that suggest he would need something, unless maybe it's an antidepressant medication, which can decrease aggression sometimes.
Do they check that you take the medicine usually?
I was going to add, so if there is a patient that you suspect is cheeking, you can do a check.
Is that what it's called, cheeking?
Yeah.
Oh, I've never heard that.
Yeah, cheeking. If you think somebody's cheating,
This motherfucker got
you can
10 kids.
stick
I go
them in their
fucking
mouth.
die another day.
Open
What the
lift up your
fuck?
tongue, stick it out, please say ah. So not because we're punishing you, but we really think this is what's good for you.
You're not having any side effects from your meds, which is unusual.
You don't trust me. Actually, it's more fundamental than that. You don't like me.
I didn't say that.
You think I'm not taking my meds.
Are you?
Yes. So what do you want me to do? You need to take a urine test? Will that earn your trust?
Actually, yeah.
The only scenario that we do this in a primary care outpatient setting is we do have controlled substances agreements. So if a patient is coming in and we're the primary prescriber for a controlled substance, we will create an agreement where we will decide how often refills are done, what would happen if medications are lost, for what period of time they're prescribed, how many number of refills, if there is ever a need for urine drug testing, how will it happen, so that there are no surprises and it doesn't feel like anyone's attacked, because this is just a universal policy.
Exactly. And when I have had urine toxins for patients for medication, it's typically because an organization requires it. So if I see professional athletes, they're going to have a urine tox not only for illicit substances, but if a professional athlete is taking a stimulant medication for ADHD, then they might have a urine test where that shows up, and it shows the professional organization they are taking their medication as they're supposed to.
What do you think about the interaction with the doctor in general? It seems like they're kind of a bit antagonistic.
They are. I don't like to have antagonistic relationships. I think you can be more direct, and he could say something like, well, what if I didn't like you? What would that mean? I don't know that you're taking your medication. The way you're behaving suggests, I don't know. It feels a little uncomfortable to watch.
Have at it.
Little dignity, please.
You know the rules I have to watch.
But you don't have that courtside seats. Can I at least use a stall?
Is that true that they have to watch what they do?
It depends, but yes, a lot of times there's somebody watching.
He's gonna mix in some meds. Oh my god.
That's highly unlikely. This is unusual to have somebody else, but people go to all kinds of lengths. Sometimes you see people using a fake prosthetic, and they've carried in urine on a long-term ward. But in certain situations, you might see that, or you might see urine hidden in a cabinet in a bathroom, and they do that. So there's all kinds of ways people try to get around this.
Sorry, I doubted you. Dream Master, think you could help me out?
You need help?
Could you move the piano for me? 500 pounds. Not too much, is it? I just want to move it away from the window.
What the fuck was that? What the fuck? They're so bad. What the fuck?
He shouldn't be here, or else he's suffering from a serious and dangerous delusion that he needs to deal with.
Again, very antagonistic approach by this doctor, wanting to disprove as opposed to building upon the premise and asking what impact it's having on the patient.
What is that? Is he eating a... Does he have...
Expose people to things that they are anxious about. And you continue to expose them until the anxiety levels come down. But you work your way up to what would be most anxiety-provoking. So threatening this guy's identity would be probably at the top. So you'd work up to that. You would not do that in a public setting.
If someone has a delusion in a scenario like this, where he says, call me by this name, I'm a superhero, I can do all these things, how do you approach that while being respectful and trying to, I guess, initiate a potential challenge so the person can feel more in touch with reality?
What I would do is I would call him by his name. I would not call him out of a group. I would not put him on public display and try to humiliate him in any way. In individual sessions, I would probably try to say, tell me more about this. When did you realize this was your identity? How did you first understand this? You work with people where they are, especially in a long-term care facility where you're not limited to a few days or weeks. This could be weeks, could be months, could be longer.
Who's she looking at?
You're not a superhero, Stephen. You're just a regular person. That's okay. We're all just regular people. It's what we do.
They stole her voice box. They have it in there. That's what she's staring at. That's what she's staring at. She's always staring
Your
in there.
wife is dead.
This feels like a bad Shakespearean play playing out in real life.
I don't... When somebody's wife has died, it's so traumatic. Why would you announce it that way? Why would you use it as a weapon to tell him you're just traumatized and you're trying to pretend to be the savior? He's probably going to be aware of his own reactions. He's the superhero. He's not supposed to show emotion in his mind, probably. He's probably also imagining he's the superhero.
I didn't...
Could have saved his wife. And I think that's what this psychiatrist is trying to show.
Collect the...
Her voice is in there. Her voice is in there. Tell Gray.
Yeah, collect the dog.
I don't know, again, that they need to pull him away from
I feel like this was created by the doctor here, as opposed to the patient.
Yeah, exactly. The doctor said, hey, I see you're upset. Why don't we try this again? Can we go have this conversation somewhere else? And now, if it escalates,
Yeah,
sure,
exactly.
bring it in.
Did you drug him?
Of course I didn't drug him.
Is he flat affect? He's practically catatonic.
Hey, we got cake.
He's fine.
The chocolate, yummy, yummy.
Don't tell me that he's fine. You did this. He was functioning. He was happy.
He was delusional.
Yeah, he's way better off now.
It seems like they're trying to stage this doctor war between pharmaceutical treatment and actually talk therapy.
Well, it's funny you mentioned that. In the 90s, there was that kind of a war in psychiatric treatment. And here, I think what they're trying to do is actually show that this doctor has given his patients too much medication. House is sensing he's been punitive. He's actually tried to punish this patient in some way for not listening to him, which again is a good thing to stand up for, whether House is standing up for the patient or just proving a point. But I do think more than the war between meds and therapy is the war between this doctor and House and this patient.
Back to House in just a second, but first, I want to tell you about Grammarly. It's an AI writing partner that helps professionals with all their writing needs with high quality and personalization. So it sounds like you, not AI. If you've been watching my channel for a while, you probably noticed I'm uploading a lot more podcasts lately. While these conversations have been truly satisfying, it has forced me to write a lot of scripted intros for each guest. This is where Grammarly's AI tools have been super helpful. I can brainstorm with the AI chat on the perfect way to intro each guest. Grammarly can provide me with tons of suggestions, particularly with the Humanizer tool that can really make sure my writing doesn't
Oh
get
my
too
God.
robotic. And of course, I'm most concerned with the audience's response to my writing, which is why I've become such a big fan of readers' reactions, which predicts questions and confusion you might have based on my current draft. Grammarly then suggests revisions to improve clarity
Could've played
and
that
get you
better,
to a
no?
final
I
draft
could've
sooner.
played that
Level up your productivity and get Grammarly today. You could use my link for 20% off Pro. All right, let's get back to House.
I'm coping better than you think. I've not been taking my meds. Not one. And yet, I still scored high functioning in your depression test.
So your proof of your well-being is that you lied.
Manipulated.
Well, the test is just asking you subjectively how you feel. Are you fooling yourself?
I know,
doing
yeah,
it?
yeah. He's trying to manipulate the system. He's doing anything he can to get the letter. Get out, get out, get out, get out, get out.
The hardest part for me as a primary care doctor with mental health conditions is what to do when a patient is unmotivated or perhaps doesn't want help, and this kind of falling into that scenario. What can one do as a provider in scenarios like that?
And I think they're actually showing, I think Dr. Nolan is doing, he's talking to him, saying, do you realize any of this? So you're saying...
I could have like 12, by the way. Could have 900 extra
try to
bonus
help
health.
somebody see the patterns
Fuck.
of behavior and how it's affecting them. Is it serving them well? Is it not serving them well? What does serving them well mean? And at other points, if this were not a medical licensing issue, I would say to somebody, I don't know how therapeutic is it to come to therapy, to be forced to be here, feel like I'm the one who wants you here, when really it should be for you. But in this case, he's not got that option. He wants to practice.
These are your posts from today?
I'm not gonna take it. I'll just cheek it again.
Lick it.
You want me to lick your hand?
I won't. Is he giving him sugar pills?
Yeah.
It's sugar.
Oh my God.
Is that ethical?
No. In fact,
flat out no.
In fact, I had a colleague recently, she was consulting on an inpatient psych unit. I was like, well, can't you just give the patient the medication, tell them it's a vitamin? No, can't do that. It's not ethical. Unless you actually get consent to say, we're going to try some different things with your medication. Some days we'll give you placebo, some days we'll give you this. So if they can be part of the treatment, yes, but that's not ethical.
Why are you so nice to me?
I think you have a good heart.
Would you still be nice to me if I told you that I lied? I'm not just driving around the grounds in your convertible. I'm kidnapping him and stealing your car.
Just to be clear, the reason he's doing this is that he has gotten privileges to leave. So when you're in a long-term care facility, you do work up to getting, okay, you can have a pass for 2 hours. Okay, you can have a pass for this many hours.
For like the
That's why
big games
he's
of this,
outside. Some people might
this,
say, what is
this,
going on?
this.
Sure. It's just starting to feel
Maybe this and this.
We had kind of
Like those games, but kind of big.
Bonnie and Clyde get shot to pieces.
Yeah, I feel like it's gonna take too long, but gotta install some of these games.
I try to put myself in a viewer's mind in a scenario like this, and I could see how in their mind they'll say, oh man, look at that other doctor was giving him medications when all he needed was to fly. And that's a very oversimplistic and incorrect view.
It is an incorrect view. What I would tell audiences they can consider taking away from this is that not all therapy, not all bonding has to happen inside the office.
How big is
I've
this
had
game?
a patient, for instance, a young woman had a heart attack. I would meet her at a
77
park and walk around
gigabytes.
with her because that was a better environment.
How big
I'm
is
not
this
going to
game?
take somebody who thinks they're a superhero to a park and do outdoor / what would be indoor skydiving.
Let me uninstall.
You can repay me by telling Nolan.
You can always reinstall
You
it,
can
so
repay him
it's
by
okay.
telling Nolan he's an idiot. That's why he wanted to do this. He wanted to prove this doctor was wrong. When it's not about the patient, it's a problem.
Careful of the traffic. We're damaging any fenders. Hey, come on, get down.
I would play dead. Act like I'm a victim and I need help.
How
And
big
I
is
hurt
this game?
myself. Because in this delusion, it seems like he's
It's a
wanting
superhero.
to save.
Yeah, I mean, that would be good
120
thinking, and there's
gigabytes.
A lot of psychiatry.
I
is
probably won't play this
improvisation,
until
so yeah,
Korea,
when you
right?
play dead,
So
you scream, you do something like that, say
uninstall it.
something wrong.
How big is this game?
Oh my God. This is the darkest episode of House MD. I did not expect that.
He's lucky to be alive.
Oh.
It's at 20.
He's got a lacerated spleen.
And then the other one is like Witcher, right? The big game is Witcher.
That's a serious injury there.
What the fuck is Witcher?
Lots of bleeding with a ruptured spleen and all those fractures. A femur fracture is notoriously hard to get because the femur is one of the
60
strongest bones in the
gigabytes.
body, if not the strongest. Uniquely, some medical situations that can arise from that is you can develop something known as a fatty embolus, where literally a piece of fat starts entering the venous system of the blood supply and can cause a plug and therefore be lethal.
I'm transferring you to Winslow Psychiatric. You'll have better luck pulling the wool over there.
160 gigabytes in here, but
Do directors just say, I'm done with you? Like,
I think with somebody very narcissistic like that, there are people that will say, I'm done. Like, you've caused so much danger, so much havoc. There are other people you can go see.
he just want to
You
delete.
should do that. Legally, there are some steps you should take.
like a
Here are other
30-day period.
give them a
transition
certain
period,
amount of
yeah.
time, give them names, all that kind of thing. But at this point, this guy knows exactly what he's doing, and the attendings, like, he's not a danger. He's
delete
not
this.
going to find some harm from being cut loose from my practice. Just let him go.
Yeah.
Don't. I need help.
Okay, he's discovering a lot faster.
Happening in my life. How am I supposed to know which ones are relevant?
As far as I'm concerned, they're all relevant.
Well, we better get moving because this session could take 50 years.
Yes, you are the sum of everything that's happened to you, and yes, some events are more relevant than others. But the only way we can figure out which ones are is to talk. So tell me, what's on your mind?
It's funny that he's talking like that, because I often open my sessions. If patients don't come in and start talking, I'll say, what's on your mind? How are you doing? If we do zoom out, I think culturally men have been taught to swallow feelings, not talk about them. It's weak to do that.
Yeah, I see that happen quite often in my practice. When they come in for a physical ailment and I start moving the conversation to a psychological
I really haven't
frame
played since then, that's
of
crazy.
mind, and they are very resistant and reluctant.
Yeah, I've had patients tell me, professional athletes especially, will tell me things like, you know, I'd rather have a broken arm than have to talk to you about this stuff.
So friends,
So
it's
now,
Smixy.
all we have to do is figure out how to get you from here to happy.
SSRIs.
That's crazy.
That's your genius technique.
I don't think we should ignore any tools that can help.
SSRIs can help with a lot of different things. It can help with decreasing aggression. It can also help with emotional regulation. So I think that's what he's
This,
gonna
I don't
try
know
to
who
convince
this is.
him to see.
I know you don't have a problem taking drugs.
For my leg. For pain.
Well, think of this as being for psychic pain.
I don't want to change who I am.
This doesn't really make
Miserable?
sense.
I get that a lot. I don't
I've
want to
played
change
more
who I
games than
am.
this,
And I'll
no?
tell them, if this makes you somebody you're not, it's the wrong medication. I have no desire to change you into somebody you're not. But I do want to help you feel better.
Van Gogh was your patient. He's satisfied painting houses instead of the starry night.
Van Gogh would still be making inspired paintings of the night sky. Just maybe not from the room of his asylum.
You don't know that.
I know both his ears would be intact. And I know his life would be better.
You don't know that.
Well,
you can hope for that.
No, but I operate in the same way where understanding them, giving them a space to be who they are, to talk about things they probably haven't talked about, to think about things in ways they haven't thought about can be helpful. And I really think that's what he's saying. Like, maybe Van Gogh wouldn't have cut off his ear.
I know this doesn't come naturally to you. But you want my help. Which means you need to trust me.
Because doctors becoming demonstrating a high level of empathy. Do you ever develop compassion fatigue?
I don't, but what fatigues me, I really want to focus on my patients in the 50 minutes, and I see back to back patients. I get tired because I'm just trying to focus, and it's very individualized. I'm not doing a generic thing with everybody. It just doesn't work that way. What happens for me at the end of the day is not compassion fatigue, but just listening fatigue. At the end of the day, saving enough for my family to be able to say what was going on in their day and all that. Because what will happen is they'll say, "How was your day?" I'm like, "It was fine."
Why is jump not?
And that's it.
Yeah.
I want you to trust people.
That's not spacebar.
That is a big issue I see in people, particularly people with a lot of trauma, is they have a really hard time trusting people. People with what's called complex PTSD.
Should blank be on the
a
right
couple
click?
days to be like, oh yeah, try it.
I feel like blank should be on my
There's a
right
reason
click.
that people don't trust people. And sometimes it takes me a long time with patients to get to that point of them realizing they don't do that. And I'll have to comment on what it's like to relate to them. So this is a very brief way of introducing the concept, but what would unfold in therapy would be a little.
I don't use items because I can make that
Just open
cute.
up. Trust.
That's like saying just chill out to someone who's having a
calm
panic.
down.
Yeah.
Don't worry about it. Like that's a little egregious, but I get what he's trying to do. It just would look differently in real life.
You asked me why I come here so often to visit Annie. She was my best friend. I think I married her brother because he was the only other one who was going through the same thing.
A little trauma bonding?
Yeah, that term does come up, trauma bonding. Someone who goes through something really difficult, someone else is going through the same thing, they understand each other in a certain way.
This is a bit of a forbidden romance.
Yeah, I was thinking it's very highly problematic for a patient on a long-term health facility. I don't know what would happen because I've never experienced that, but I think it would certainly be addressed. I'd say this isn't healthy for people involved, and
Is there a world where it is healthy?
no, not that I can think of.
We kissed each other.
And how do you feel about that?
How do I feel about that? It was a kiss. Kisses are good things.
Okay.
That was the road to the kiss.
Not at all. What would you say?
You're being judgmental. If I said that
I'm playing Ivern. Fuck.
Seabass for dinner last night, would you say, and how do you feel about that?
If the Seabass was married, I might.
That's a good line.
Yeah, it is. What I think is good here is Nolan's matching house in wits. You have to have some buy-in from your patients. So if they need you to be somewhat on the offensive at times and it benefits them, and you're not hurting them, then I think that's okay.
Why do you value your failures more than your successes?
Successes only last until someone screws them up. Failures are forever.
So you accept that fact. You accept that there's nothing you can do.
Okay, I accept the fact that there's nothing I can do. Now, what can I do?
You acknowledge failure and you move past it.
He's being very direct here. Is that the...
It can be a style of therapy for sure.
They get right to
I think
ruin.
House operates in a direct way. So I would say something like that if it's a patient like this.
Yeah.
If it's somebody else, no, it doesn't fit.
You're not just doing that generically.
No, not at all.
Someone to jump up a building, you say 2 words, you move on with your life. Hardly seems
What
fair.
the fuck?
Is that the issue? You have to suffer equally? You're not God House. You're just another screwed up human being who needs to move on. Apologize to him.
In doing this type of therapy, there are so many moral, legal, cultural things that need to be taken into consideration. How does one balance what is right to do? Like, he's like, the right thing to do would be to apologize or whatever statement he's making there.
I learned that by observing the patient and understanding them and having them tell me about their family culture and what they think. I learned about their choices and I learned that along the way. I wouldn't say it's the right thing to do to a patient. I would say, what would it be like if you considered apologizing? How would that feel? If they're like, well, that would be wrong, or that would be right, I'll say, what's right about it? What's wrong about it?
So you want them to be more reflective?
I want, yes, it's so much better to have it come from them than for me to say.
Diane, maybe you and I can work together and figure something out.
I can save him.
My teammate is a pig!
He stole her voice box. That's what he said. That's what she was staring at.
I got instant Winston Churchill. Is that fucking Cora?
House, please.
There's a music box in there.
Orderly.
Come on, just give it to me. I get. I am not having a psychotic break.
This seems he's having a psychotic.
Well, it's just funny that earlier when the guy was trying to get this music box, they came and took him away. So psychotic break is actually when you have this disconnection from reality. You might be hearing voices or seeing things that aren't there. Your thinking might be all over the place. He's trying to
right,
get your attention.
everyone.
He's trying to say, look, no, there's something you should think about.
This is what you wanted. You thought you could cure some girl with this. It's by your own rationale it should cure you. There's nothing wrong with you. You're healing. All the parts work. Speak. Come on, speak. Say something.
I think maybe everyone should take a break now.
Yeah, hands on another patient. It's not okay. I think still this shows House is doing this for himself.
I think I'm gonna run out of mana. I think I actually need a mana item like Arcane Jewels.
What a great acting gig. Hey, we're gonna hire you just to stand a bunch and sit and then open this box.
Thank you.
Dramatic.
Yeah, a little dramatic.
Yeah.
I don't know the...
Not that it would. There's no like instant cure, right? Is that?
And I think the message, even love or even a loving moment isn't necessarily cure catatonia.
This is a problem with medical dramas, in my opinion. It creates a false understanding because most people watching this are like, oh,
Are they hot
that's
still
simple
stacking?
sometimes. So everyone's searching for their music box.
Yes, that's why I'm writing medical dramas with the right, appropriate perspective. Yeah.
I can't break up my family. I can't leave my children. I have to go.
She left. And I'm lost.
I'm gonna write your letter.
And they got like an Imperium,
Recommending
a
that
Cruelty, a Spellblade,
Giving me a lollipop when I skid my knee.
Well, two things.
a Locket.
You got hurt, which means you connected to someone
Fuck
else
me.
strongly enough to miss them. And more important, you recognize the pain when you talk to me instead of hiding from it in the Vicodin home.
That seems like a good analysis.
It is.
Yeah, for the
It is.
first time in a little bit.
I see patients who have addiction issues, and a lot of times what they're addicted to is covering up their feelings.
Okay, I lose
covering up
15
their
AP, but I get the
emotions.
safeguard
to be able to
passes,
come to
whatever.
somebody and talk about it instead of going back to Vicodin or alcohol or cocaine or whatever it is healthy.
Today, we're here to congratulate Greg. We're proud of him, we wish him well, and we hope to never see him again.
Is that a thing that people say?
I have not seen this. I think there's some body.
Please leave now.
Yeah. But I get the sentiment. The sentiment is we want you to succeed. We want you to be out there in the world. We want you to have the experiences you want and to be healthy.
So, scale of accuracy on the psychiatric component here.
I honestly think they did a pretty good job. With some of the things we talked about, I'd say they're closer to 7, 8, to be honest.
Yeah, for shows where the medical
Guys,
accuracy
they have
sometimes
flash.
takes
No wonder.
straying into the complete
Guys got
unknown.
fucking hit
This
on.
it held pretty true with some dramatizations that perhaps made it less realistic, but overall, I think the message was pretty good there. You know, doctors sometimes can be pretty ruthless. Click here if you want to check out a video of some awful things doctors actually said to patients. Huge thanks to Dr. Eric Bender for coming on the channel. His channel is linked below. Click that, check that out as well. And as always, stay happy and healthy.
Good hand washing technique. Could be a surgeon. I don't know yet. Oh.
Somebody call 911!
Well, calling for help is the right thing. That's the first thing you want to do in these types of situations.
His jugular veins be cut. Does anyone have a clean cloth?
How does he know it's the jugular vein? That's pretty impressive.
That's great.
That's from the chase from items. Why can't I shield my fucking Daisy? Just showed it.
Pressure on a wound like this is the first thing you need to do outside of obviously calling for help. Anything you can do to stop the bleeding, put pressure on the site is important in order to help that person survive.
Why does he even have overlords?
I'm saving his life. He was bleeding out.
No, you have it in the wrong place.
I think I remember enough of Anatomy 101 to know where the jugular vein is.
You would be in the right place if he were an adult. He's not an adult. He is a boy, which means you're also putting pressure on his trachea, which means he's not currently breathing.
I can't really see where his hands are, but it's good advice. There. Don't take it out.
Some glass.
Don't take it out.
He'll be fine.
Yeah.
Who are you?
Hello. I'm Dr. Sean Murphy. I'm a surgical resident at San Jose St. Bonaventure Hospital.
Well, hello, Dr. Sean. Nice to meet you. By the way, just so you know, if you have an object inserted into you, I know that sounds kind of weird. If you get stabbed with a knife, if some glass goes inside of you, if a nail goes inside of you, never pull it out. Make sure you call 911, let the paramedics decide what to do, let them take you to the nearest hospital, because a lot of times what that object is doing is preventing you from bleeding out because it's putting pressure on the spot where the artery or vein was cut.
A special meeting of the board of directors. As much as I love you all, questioning one of my hiring decisions. Did you bother to look up the definition of president while you were skimming the dictionary?
You're hiring him to be a surgical resident. My department over my objections.
The bureaucracy that you're seeing here is real. There are board members, there's presidents, there's employees, there's trust funds. So these things exist. They put a lot of pressure on doctors and presidents to make certain decisions.
Yes, he has autism, but he also has savant syndrome. Genius level skills in several areas. He has
guy doesn't carry on fuck, by the way.
He has spatial intelligence, and he sees things and analyzes things in ways that are just remarkable, in ways that we can't even begin to understand. Those are assets, undeniable assets for any doctor, particularly a surgeon.
I'm not gonna lie, I agree with the president on that. As a surgeon, it's more important to have very good spatial ability, to be able to have perfect recall, to understand the anatomy perfectly, than it probably is to explain the complexity of a specific case and be able to communicate well with people. Most of the time, when you're a surgeon, your patient is not awake. That being said, I think it is still important for surgeons to be able to improve their communication, help them understand the risks and benefits of
have to get a moonstone,
and make
right?
sure that they don't force patients to go
Kinda true. I don't have to get a
You seen
moonstone.
her?
No,
Buff?
turn up the light.
Sure.
I think it's fucking buffed.
Ooh. Resident beef. Resident beef. Oh.
I heard.
And here I thought this was going to be an all-medical show, no Grey's Anatomy drama. At least where I practice medicine, there's different on-call rooms for males and females. There are times where one of the call rooms may be unavailable, and you do have to have a male and a female sleeping in a room together. Usually it's not a problem, but this is unprofessional, folks. It's going to lead to drama. Lots of drama.
We don't have a relationship. We have sex. But
you have a sexual relationship.
Wish I could be one shot.
I wish I had vision like that. Caused by increased intrathoracic pressure inside the chest cavity. He's basically saying the veins in the arms are swollen, so he thinks there's some extra pressure going on inside the chest cavity. Can be because of cardiac tamponade, which means that there's blood, usually in a traumatic sense like this,
I'll
inside
shoot
the
myself.
pericardial tissue, which is the lining of the heart, and there could be blood in there, and it makes the heart unable to beat properly.
The veins in the boy's left arm
A
are
new
popping.
parasitic relationship.
I don't see.
Intrathoracic pressure.
No, his chest is rising. He's breathing.
The chest is moving paradoxically.
Paradoxical chest movement is a consequence of something known as flail chest. If you get a trauma where a section of your ribs break from the rest of the ribs, that part of the rib cage doesn't move normally when you take a deep breath in and deep breath out. So the chest sort of moves paradoxically. That's what he's talking about. What happens during a pneumothorax one of the lungs collapses, or sometimes both of the lungs collapse, and
I
you
get more
can't
crit chance.
oxygenate that area, meaning that when you breathe, no oxygen goes to that area. It causes increased pressure. The life-saving treatment for this is to literally insert a needle in order to release some of that pressure.
Who here has a sharp knife?
Oh!
Blade 5 inches or longer? Nobody?
Is he going to go into the second or fourth intercostal space?
Can't be back here. Oh, I need a knife. What do you think?
He's going to TSA.
A knife? Sure. Anything else?
I do also need a narrow 6-foot tube and high-proof alcohol and gloves and baggage handling tape, but I'm going to get the alcohol from the duty-free store and the tube from the back of the soda machine.
He's going to put a chest tube for a traumatic pneumothorax.
I go for prismatic, I think.
Looks like he's going to party with all that Jim Beam.
All these items are not the
Not
best.
having an emergency medical emergency, but
Because do I get locket? Okay.
I always found that blowing to the glove thing really obnoxious. How much bacteria do you have in your mouth? Probably even more than your fingers. You're blowing it inside the glove, but you're getting some of that bacteria on the outside of the glove that you want clean or relatively clean when you're gonna go insert a chest tube into a young boy. He's gonna clean his hands with a Jim Beam, but that's not perfect.
Yo, dipshit.
Incision should take place 2 ribs down.
Second intercostal space, my man. He's actually following proper technique because you want to stay in the mid-axillary line, meaning in the middle of your armpit. That way you have a lower probability of hitting the heart when you go in with a scalpel or whatever you're going in with.
Okay, well, why the bottom?
The air will
What the
continue
fuck?
to accumulate until the damage can be properly repaired. The tube allows the air to get out. The water in the bottle stops the air from coming back in.
Oh,
My game's bugged.
He's breathing.
What the fuck, game ass bitch ass. My game fucking.
Attention pneumothorax, you can literally
I could
put
click out of
a
fucking.
needle in that can release some air, and that equilibrium does enough of a job. You didn't need all of this fancy technology here.
I need to get to San Jose St. Bonaventure Hospital.
That's where we're going.
Good.
One of the classic signs that someone has autism or may have autism is they don't make great eye contact. They're not great at picking up social cues. If you find out that your child has autism, you can start using these early intervention programs where they teach them how to mimic some of these social cues, where they're not looking to make eye contact with you like we do normally because we have good physical recognition and body language recognition, but they do so because they're
fucking
trained
dipshit.
to make conversation seem more normal. Early intervention has shown
Oh
some
my
very
fucking
promising
God.
results for those with autism.
Find another school. No, we won't, because nothing's gonna change. They can't handle him. I don't blame them, because obviously we can't handle him either. What the hell happened?
Oh my fucking god. What is it this time? You fucking.
What did you do?
Those who have autism and grow up with pets actually have better results moving forward in terms of communication, in terms of interpersonability. So if your child
Oh my fucking god.
getting them a pet early on definitely serves a benefit.
It changed.
Stop.
The boy's ECG changed.
It's the same.
What the fuck?
No, it used to be high.
No, it used to be 86. It's still 86.
It used to come up to here.
Oh my fucking god. What the fuck is this shit? Fuck off.
You have to be looking at
Oh
the
my.
strip and comparing the little boxes on the screen. Maybe this guy, he has superhuman powers, it's possible, but in reality, you need to be a
Oh
lot
my
more careful
fucking
'cause
God.
this isn't just a game, it's people's lives at risk.
8-year-old healthy boy. Status post-encounter with a shattered glass sign. Numerous lacerations.
Echo.
Get him set up in trauma 3 with an EKG, full blood work, and a pan scan.
What
So
the
far,
fuck?
very accurate, I'm very impressed.
What the
way that
fuck is this piece of
paramedic
shit
told the
game?
history, very, very accurate.
Adam needs an echocardiogram.
No, behave yourself, or you'll be removed from the building.
What the fuck? This piece of shit game. Yo.
I don't know what to make of this guy. I like him because he's superhuman and knows everything, but it's just so unrealistic, it's crazy. Is this the same security guard who knows everywhere he's gonna go? Maybe this guy's
Oh
a
my
savant
fucking god.
Do an echo.
Sir, the boy's wide open. It's gonna take a while.
Good. That'll give me time to figure out why the hell we're doing an echo. Dr. Brown, you're with me. We're gonna go find your weird guy. Keep him stable.
Surgeons just don't go and look for another doctor or someone else on the street that wanted to give them a recommendation on how to treat this patient.
I noticed that there was a slight reduction in the intensity of the electrocardiogram.
The electrical flow, I noticed that too. The heart rate was the same, but the amplitude dropped.
Pericardial effusion.
Reduced cardiac output,
Would stress other organs.
causing them to shut down.
Yes.
Just to break that down, pericardial effusion, peri means surrounding the heart, the tissue surrounding the heart. Sometimes there's fluid there, and when there's fluid there, that makes it difficult for the heart to beat, and you get cardiac tamponade. That's what I was talking about earlier.